what is that self-talk saying to ourselves? And so once we're able to really have a breakthrough in our mental, then we can start focus on some of the other components like nutrition, being mindful of your environment, right? Your environmental exposures, and your environment in terms of the people that you're connected to, because sometimes people that we're connected to are not always, positive for us, right? We do have people that are toxic for us or are that cancers for us. So I would definitely say, those are things to start there. And then community connection is so critical and so key. You will learn so much about other experiences, how to advocate for yourself, the right questions to ask, what tests you should be getting, what is standard of care that you should be getting. Those are things, critical things that we should be having conversations about with other people, and we can glean from their experiences and gain some insight to help us with our own battle for breast cancer. For myself, I did a lot of research, I did a lot of studying, and I didn't have the resources, the financial resources. As a matter of fact, after I was diagnosed the first time, I was laid off from my job. My job was undergoing a merger and my position got eliminated. And so from there, I wasn't ready to jump back into corporate America. I was still trying to heal from what my body had gone through, and I wasn't working. And so when I got hit with the recurrence of breast cancer again, I was on Medicaid. And so just think about that. I didn't have the means. I didn't have the resources to go to, a hospital, a more holistic hospital, somewhere in Mexico or anything like that. And so because I had done the work, I had done the research prior to and had started to work on making those lifestyle changes, I felt that I was more equipped to be able to take the things that I learned to give myself a fighting chance and start there. And so, like I said, after 3 months of when I was initially diagnosed with the recurrence, when I went back after my second scan and the doctor said, hey, your tumors are shrinking and disappearing. It went from 5 lymph nodes down to 3. So I knew that whatever I was doing, it was working. And even the doctor said that. And so I continued to stay on that path. And then the pandemic hit and I continued to stay on that path until I was actually told, hey, I don't know what to do with you. Your cancer is not behaving like it's supposed to. All I can do is just monitor you for the rest of your life. I mean, right now, there's no evidence of disease. You're cancer free. That's what I was told 2 years later. And so I don't tell people do what I did, right? Because what I did doesn't work for everyone. But what I do say is you have to do your own research. You have to, do the work. And again, not everybody is willing to do the work. But if you're willing to do the work, that's where we can really have, a deeper conversation to support each other and to help each other.
The name of your support group again?
Yeah, so our organization, My Style Matters, we're based in Atlanta, Georgia. We're headquartered here. And we have a sisterhood called My Breast Years Ahead. We also have a program. It's a 12-week transformative program for Black and Latina women that focuses on, we focus on mindfulness, stress, self-advocacy, nutrition, physical activity, sleep, because that's another thing that we're not talking enough about, and reducing your exposures. And that is called Her Support. So it's intended for women who are disproportionately affected by breast cancer. We recognize that we have unique needs, and so we're here to support. But our organization, we support, all women who have been affected by this disease. We recently even launched, as of yesterday, a course. It's on our website. It's a trauma-informed cancer survivorship curriculum for Black and Latina women with breast and cervical cancer. And so, this information that we're putting out here is very important because we don't always have the resources or the connection or the support to really just help us. And so our goal is really to, provide that information to you. We always say, speak to your doctor, but we provide that information to the women that we support because nobody else is giving that to them. I mean, I remember when I went for my orientation, and I know it's crazy to say orientation before I started chemo, and I asked, what could I do to help myself? And I was told nothing. And that didn't sit well with me. That made me feel like, we're just waiting for the
Mm,
other shoe to fall off the foot, right? And so
yeah,
I
yeah,
wasn't told eat healthy. I was told eat whatever you want to eat. There's snack machines that had, Snicker bars and candy and sodas and chips in the infusion center. And that just didn't sit well with me. And so I know that this information is needed. So, we developed a program that is, relevant to our culture, right? And it's really to build sisterhood, to build community, but also to hold the hands of women who want to make these changes. And so that's who we are. That's what we're all about, is we're here to support our women, to help them improve their health outcomes, and also teach them and empower them to self-advocate so they can get the
yeah,
care that they need and deserve.
yeah. It's almost embarrassing that I call myself a doctor when you tell me that the oncologist told you that there's nothing you can do to help. That it's almost an embarrassment to the medical community and to the specialty of oncology. I don't know why they don't read that book, Radical Remissions. It's just it's mind-boggling to me that a lot of physicians aren't interested in expanding their knowledge of how to help patients. And I thought that's why we went to medical school, is so we could help patients. But then we close ourselves off to other avenues that we could expose our patients to. So I'm embarrassed. I'm embarrassed that the oncologist told you that. And so I know you have a meeting to go to, Atia, but I needed my viewers and listeners to see a real life remission story that is really you had the worst kind of cancer. You had a recurrence, which is almost always fatal when you have a triple negative, if you don't do the work that she's talking about. And that's what it is. It's not easy. Cancer is it's not like a cold. It's not going to go away in 3 or 4 days, where you just take some aspirin. It takes hard work. But if you do the work, and again, like she said, you may not do exactly what she's doing, but there's all these possibilities out there. And that's what I want cancer patients to know, that there's possibilities out there. And don't get overcome with fear. If you can get over that fear, then you can start to see the possibilities. So Tia, you have any last words? I know you have a meeting. I don't want to keep you. I promised you it was 15 minutes. So you have any last words?
Yeah, again, thank you for having me here. If anyone
Yeah.
is interested in connecting with us, they can follow us on social media. All of our tags are at My Style Matters. They can follow us on our website, www.mystylematters.org. And, just keep the faith,
Yeah.
even if it's hard. I cried every single day, but I kept doing the work, right? And I
Yeah.
kept speaking positivity regardless of how I felt, even if, what I was seeing. I mean, I had a girlfriend at the time who was battling the same disease. We were kind of similar in our diagnosis. She had a recurrence. Hers came back at stage 4. And she was transitioning at the time. And I was watching this happen to her. And it was very, very scary for me. But I
Yeah.
just had to keep speaking life. I
Yeah.
had to keep speaking life and believing in my healing. And so I would just encourage anyone, even if you're fearful, keep speaking life to yourself, because at some point, your words and your beliefs will align itself, and you'll be able to say, like I said, I'm healed and nobody can tell me different.
That's why I've since we've last talked, I've kind of embodied this persona of the spiritual MD, because I have figured out how important spirituality and mindfulness is. And then, when you talk about keeping the faith, I say I live by First Corinthians 13th chapter. In the last verse, it says, faith, hope, and love, but the greatest of these is love. So you need all of that, and you need to love yourself, and you need to keep the faith, and you need to keep hope alive. And that's what she's talking about, speaking life to yourself. And what you say to yourself is the most important thing. I think is that you have to keep speaking to yourself what you believe. So Tia, again, thank you as always. It's always inspiring for me to hear you, and it just keeps me. It helps me to keep the faith, to keep talking about this to the cancer patients that come to me. So again, thank you. And please go to her website and support her in any way you can. And again, we appreciate you, Ms. Harris.
Awesome. Thank you. Thank you for
All right,
having
all
me.
right,
Take care.
all right, all right. Thank you. Bye bye. All right. I had to go. I had to, for some reason, my internet in my study did not work. This is my extra bedroom, and I kind of go here to. This is where I do a lot of my study and uh, plan for these podcasts. So let's take a break, and we're going to come back and we're going to go quickly over these nine habits that you need to think about incorporating into your life. If you have been diagnosed with cancer, if you want to prevent cancer, or if you have a loved one who is dealing with that diagnosis, these are things that you can incorporate into your daily life that could lead to a radical remission. All right. So let's with all this confusion, let's take a break and let's just get a brand new start. Okay.
We are going to a quick break, so stay with us as we explore the ageless blueprint right here on W4HC Radio and Talk4 TV. An ancient secret with a modern twist for better health and vitality. Dr. Taylor will be right back. Taking care of your health shouldn't mean taking a handful of pills every day. At Taylor MD Formulations, they create doctor-developed supplements that combine the best natural ingredients so you get the results you need with fewer pills. Taylor MD Formulations is backed by science, designed for real life with real results. Less pills, better health, doctor approved. Shop now at TaylorMDFormulations.com and discover smarter supplements for smarter health. That's TaylorMDFormulations.com. We are back for more of Ageless Blueprint. Once again, let's join Dr. Taylor for more insights and research on the ancient secret to better health and a better life in modern times. Here's your host, Dr. Eldred Taylor.
Okay. All right. So we're here. This is kind of my study area here. So you get to see a little behind the scenes area here, but I don't know what happened to my internet in my study there. So, hey, where there's a will, there's a way. So let's get right to it. I hope you enjoyed that guest. She is so inspiring to me. I've had the privilege to talk to her group a couple of times, and these are some of the bravest women you'll ever